We're excited to have one of RMU's co-founders on the episode today, Dr. Richard Nielsen. Welcome.
Thank you.
Yeah.
Thank you. It's good to be here.
Appreciate you taking some time. We're in his office, so we're taking the podcast on the road here. This is an interesting office you have here.
Thank you. It's kind of a collection of life's experiences.
Yeah, that's fantastic. Well, first off, let's start with the hardest part, pronouncing the name of this topic. Electroneuromyography. Did I get it?
You got it.
All right.
Electroneuromyography. So if you break that down, electro is electricity, neuro is nerve, myo is muscle, and ography is the study of. So it's the electrical study of nerve and muscle.
When you look at that word, it's really intimidating, but when you break it down, it's a little bit easier to digest. So.
And that's why we kind of refer to it generally in the industry as EMG.
Yeah, so how did you get into EMG? And if you could give us a little bit of your background, where you're from, where you went to school, and how you ended up in that.
Born and raised right here in Utah County.
Okay.
And went to BYU. Went to University of Utah. And yes, I am a BYU fan, unless University of Utah is not playing BYU.
There you go.
Following that, I got my physical therapy training at the University of Utah. And then I went into the Navy. This was back during the latter part of Vietnam. I linked up with a guy in my first couple years in the Navy, Dr. Mike Scourgia.
Right.
He and I were kind of partners in the Navy for 20 years, and then following that, we continued our partnership as we founded Rocky Mountain University and also the Nordic College of Medicine. So we've been partners now for 45 years. He also does EMG, so we speak the same language. So that's how I got my start. He and I started a business way back in the early 80s in 1981. It was called the Electrophysiology Testing Seminars, and we actually went around the country, excuse me, and taught physical therapists, podiatrists, physicians, some nurses, PAs, how to do EMG. So Mike and I have been doing EMG education training for close to 45 years or so now.
Oh, wow. You say electrophysiology. Is that the same thing as EMG?
Yeah, it's another clinical electrophysiology, EMG, ENMG, electroneuromyography. They all pretty much say the same thing.
Okay, great. And you broke the word down for us, but in simple terms, what exactly is EMG?
Yeah, so as the name
somebody?
implies, it's the electrical assessment of nerve and muscle tissue. So anytime a patient has complaints of numbness, tingling, pain, weakness, or burning, any of those symptoms, typically they could be a candidate for an EMG study to determine what's going on with the patient, what's not going on with the patient, which sometimes is even as important to know. So physicians like primary care doctors, orthopedic surgeons, neurosurgeons, there's podiatrists, whoever, have patients who come in with nerve-type symptoms or muscle problem. EMG is more of a diagnostic study. It's not a treatment. So once I see the patient and I determine what is or what isn't going on with the patient, then I can effectively, refer the patient either out to another provider or send them back to the referring physician or provider saying, hey, this is what's going on with the patient. It really helps. Insurance companies nowadays are not mandating, but they're very highly requiring almost EMG studies to be done on patients because, if you just make the diagnosis on clinical suspicion, like the patient comes in and complains of these symptoms, and you think, well, it could be this, or it could be that. We just decided when we both retired, he retired in 1992 and I retired in 1994, and we decided that we wanted to do something in quality education, and our objective was to initially to do that with physical therapy education. But when we started looking at the crazy idea of building a university, and by the way, if you ever want to build a university, come and see me first, okay?
We'll meet at Sizzler. There's a little background there.
Yeah. We started realizing that, it's not just electrophysiology that we can help. It's all these other specialties. So in the early days, we started programs in geriatrics and in hand rehabilitation, orthopedics, sports medicine, cardiopulmonary pathophysiology. We started programs in those early days in each of those specialties. The one focus that we had was obviously clinical electrophysiology, because we'd both been training hundreds and thousands of people. So we wanted to extend that in the clinical electrophysiology. So that was really the whole impetus for us doing Rocky Mountain University, was to initially train electrophysiologists. It took us about 4 years to develop the infrastructure of the university. But our first class of students consisted of 8 students who wanted to get a Doctor of Science, DSc degree in clinical electrophysiology. And so they were the first batch of students in January of 1999. We went on and brought in several more different cohorts of DSc. I think that right now there's about close to 30 DSc graduates. Of those 225 board-certified specialists, there's probably about 30 of those who have a DSc degree from Rocky Mountain University.
Oh, wow.
So our whole focus, really, I mean, if you really look at the grassroots of Rocky Mountain University, it was all focused on electrophysiology. That's the whole thing.
Yeah, that's fascinating. Yeah. It's interesting to see how that's evolved, and now we have the Doctor of Physical Therapy in 8 different medical healthcare professions. That's fascinating.
And even the medical school really was an offspring of that whole idea, the whole thought.
So how many EMG studies have you performed in your career? Do you have a case or two that you could highlight?
No. Yeah, I've done over, so I'm board certified. When you're board certified for 10 years.
Oh, okay.
And then you have to recertify.
Yeah. Okay.
So I've 4 times recertified. So I've been doing this for close to half a century.
Wow.
And I've done over 50,000 EMG studies in my career.
Oh my goodness.
So yeah, and that's a lot, but that's really been my whole focus of my career. As far as cases to highlight, I mean, the thing that I enjoy more than anything, in October of 2014, we had a hand in starting the community rehab clinic, and Mike and I, and the whole purpose of that clinic was to make in those days make physical therapy rehabilitation available to citizens within Utah County who couldn't afford the care.
Yeah.
So it was a pro bono model, and none existed in the state of Utah at that time. So we opened that clinic in October of 2014. One of the services we provided was EMG for those patients. And Mike never did really do any of the EMGs over there because he was living in San Diego, but I regularly performed EMGs over in that clinic. And I have to tell you that I can't tell you a specific case. I could, but there is such a great blessing that I feel in my life when I can provide care for people who I know can't afford it and would never get it. And really, EMG is really the kind of the gateway to getting better, because a lot of providers in the community are not going to take time to see patients who are indigent, homeless, uninsured, right? So if we can get them in the door, figure out what's wrong with them, then we can make the referrals out. I can call the hand surgeon, who's a good friend of mine, and say, listen, I got this patient, it's indigent. This is what I found, and would you be willing to see this patient? And they usually always say, yes, we'll do that. And they more do it for me than they do for the patient. But the more they do that, they realize this is the thing that they go home at the end of the day, look in the mirror and say to themselves, you know what, today was a great day because I helped that patient. So that was where my greatest joy, when I was the president of Rocky Mountain University from 2014 on, I look forward every week to go over and see those patients at the CRC patient clinic, and I still see them here in this.
Yeah,
So this is an extension of the CRC. So this is where I'm still seeing these patients pro bono, and I really try to instill that in the hearts and the minds and the hands of those people that I train. That is, if you chase the money in your profession, you're going to fail.
Yeah.
I promise you, you will fail. But if you chase the opportunity to be able to help people and make humanity better, you will succeed. Okay, so that's what I try to instill in our DTBT students who are still at the CRC, who go over and work at the CRC.
Yeah. Well, the model that I love that you established here at RMU is that you have both a clinical and a classroom setting. So you're helping not only just patients, but you're also helping students help the patients. So it's multifunctional, and it seems like you're continuing that here within your own clinic as well.
Yeah, it's very important. And even when we started RMU, as we hired these faculty, I'll use the DPT as an example. When we hired these faculty, we have 25 or so DPT faculty, and we said to them, listen, I want you to go out there, I want your hands dirty in the profession. So when you come back to the classroom, you're saying, listen, let me tell you a patient I saw just last week, or I want to tell you about a patient I saw yesterday morning, right? So it's fresh, and those students are going to be educated at a very higher level than if you're taking somebody who hasn't been in the clinic for 20 years, and they're in the academic environment, and they're trying to teach things that are not really current standards of practice and things of that nature. So the students get a higher level of education, and that essentially translates into those patients get better care.
Sure.
We have right now, Rocky Mountain University graduates right now are treating and caring for over 15 million patients every year.
Wow.
If you do the numbers on that, that's about 60,000 patients every single day. Somewhere in this country are having the patients are having hands laid on them by RMU graduates. And it's not just seeing those patients, it's treating them and effectively managing their care to the point where those patients are getting higher quality of care.
I love that there's an alumni in every single state in the nation.
Yeah.
So it's quite the ripple effect from Provo, Utah.
It is.
So what would you share to a person who is considering entering this specialty field, and what would your message be for somebody considering attending the EMG symposium?
Yeah, as far as entering the field, I say this to my students all the time when I train these DP2 cohorts. And the first day I have them in there, I say, listen, this is the best kept secret in medicine. It truly is. Because in electrophysiology, you get to exercise everything you learn at all levels of your professional training. Anatomy, physiology, pathophysiology, biomechanics, arthrokinematics, all those things you learn that in most settings in the profession, especially in physical therapy, you may not ever use all those things. But in electrophysiology, you're going to use them every single day. So it's something that keeps everything you learned at the basic level, keeps it alive, keeps it regenerating every single day. It makes going to work exciting because you get to use all those tools that you learned at a basic level, and now that you've advanced and you've improved in the skill sets. So it really truly is. I know probably every one of the board certified PTs out there that are practicing, most of them, if not all of them. But in fact, I've trained many of them. And if I ask them the question, if you had to do all over again, would you choose the same pathway?
Yeah.
I don't think that there would be one that would say, no, I would never do that. I think that they would all say, absolutely, it's the best thing that I ever did. As far as the EMG symposium, we attract the greatest minds, the greatest hands in electrophysiology in the world that are attending that symposium. When you walk into that room and you see over 100 people, either online who are online or they're in person, and you think, man, what is the combined education experience of all these people? You get 100 people there. I mean, some of these people have been practicing 30 and 40 and 50 years. So you can do the math on that. There's more minds of electrophysiology in that one setting than there is probably anywhere on the planet.
Wow.
And so the people who are coming to the symposium get exposure to presentations, lectures, even techniques that we use. We bring in keynote speakers every year that just enhance even the most highly trained and experienced EMGers walk away with some other tool they can put in their toolbox and learn. And plus that you can't really put a price on the interaction,
Yeah.
Like I have every one of my students that I'm training now, I have come to that symposium this year.
It's probably like an EMG family reunion.
It is. And these kids don't know any of these people, right? Because they're brand new in the industry. But I take time and I say, well, I want you to meet this person. It's like, oh, that person wrote the textbook. Or this person. Oh, that person's on the speaking circuit for EMGs. There's a high level of experience and reputation of the attendees of the symposium that is just all of us just grow from each other's experience. But we follow each other's career. We know when they're speaking at the different professional association conferences, or when they wrote a book, or published an article. I mean, I just published an article with two other of my colleagues, and it just was released about a month ago. And I can't tell you how many people called me, from that family and said, hey, I just read your article. Congratulations. It was great. It satisfies the CME requirements as well. So you get CME credits for attending. But so if I can put a plug in for the EMG Symposium, it's probably one of the greatest gathering of minds and hands in electrophysiology of anywhere on the face of the planet.
Plus, you get to spend some time in Utah. That's
Yeah.
no better place on
That
earth.
as well.
Yeah. Well, thank you so much, Rick, for sharing your insight into EMG and for sharing your heart of service with us. And it's been a fascinating conversation. We could go on for hours,
Yeah.
but maybe we'll have you come back another time. But thank you.
Thank you. It's been a joy.
Thank you for watching this episode of The Pulse. Tune in again.